This is continuation of care of special populations. Socioeconomically disadvantaged individuals and families. Disadvantage in the socioeconomic sense can correlate with poor health outcomes. Education level, income, family, social support, and community safety are factors that can influence health and health outcomes. These individuals are likely to engage in risky health behaviors such as smoking, alcohol use, recreational drug use, physical inactivity, poor nutrition, and engagement in criminal violence. Due to limited financial means to purchase health insurance, pay for healthcare services, and afford healthy foods and other resources, these individuals are at a higher risk for chronic disease and any diseases associated with primary prevention. The health of children can be affected later in life due to risk factors. Healthcare considerations for this group of people include social work services, which are helpful in connecting this population to needed healthcare services, as well as resources to assist in paying for healthcare. Direct pay clinics offer access to affordable healthcare services. Uninsured and underinsured individuals. Individuals with low incomes are most at risk for being uninsured or underinsured. Those who are uninsured or underinsured are at increased risk for health complications due to lack of access to care and the likelihood that preventive care services and chronic disease management will not be sought. Most individuals receive health insurance coverage through an employer. If the employer doesn't offer this coverage, the employee is at risk for being uninsured or underinsured. Medicaid is an option for some low-income families who meet eligibility requirement. Risk factors and healthcare considerations are the same with socioeconomically disadvantaged individuals. Intellectually disabled individuals. They are at high risk for certain health disorders. Often, these disorders go untreated due to atypical symptom presentation, which leads to secondary problems later in life. Communication barriers between healthcare professionals and those with an intellectual disability presents a unique challenge in identifying and managing healthcare needs in this population. These clients tend to be poor historians. They are at high risk for health conditions like motor deficits, epilepsy, allergies, otitis media, GERD, dysmenorrhea, sleep problems, mental illness, vision and hearing impairments, constipation, and oral health problems. These clients tend to eat quickly, so choking and aspiration presents a safety risk. Certain conditions can cause changes in behavior. For example, there may be eating disturbances due to GERD or self-injury due to presence of an ear infection. Healthcare considerations among this group include functional behavioral assessment to identify existing health problems. Awareness of altered behavior as a manifestation of an illness is important in early identification and prevention of secondary problems. Health interventions should be focused on treating a medical condition, followed by behavioral interventions to prevent continued behavioral response to an illness.